Good morning. Welcome to Senior Circuit. We're so glad to have you here today. I have some very special guests with me today. To my right, your left, is going to be Janice Philpott, who is the Executive Director for Scale, who is housed with us. Welcome, Janice.
Welcome, Cindy. Thank you.
Thank you so much for being here. And I have to my left, your right, Robert Marlin and James Figueredo. Did I do it right?
You did.
Thank you. And you're both from Cambridge Health Alliance. So, Janice, I'm going to ask you first. Tell us a little bit about what you do at Scale and what Scale actually is.
Okay, Scale is the adult and community education program for the city of Somerville. I like to say to individuals, my job is to make sure that the city and residents of Somerville have the ability to read and write and develop their skills in academics.
Great program. And you're housed with us, and we do a lot of different programming together. We especially like it when they're putting their plays on and you come up and ask us to be critics, which they are critics. So thank you so much. It's always a pleasure.
Thanks.
And James and Robert, tell me a little bit about, each of you take a turn, tell me what you do, what your role is at the Cambridge Health Alliance. Robert, you want to start?
Sure. So I'm a primary care physician there. And this year I'm also a fellow in a new program in innovation. And so I'm developing a program for community health workers.
Great. And James?
I'm manager of health education and access in our community health improvement department. Under that, I oversee two programs, one being the volunteer health advisor program that recruits and trains about 40 to 50 volunteers to do health education and screening work. The other part of my job is I oversee Aging Wisely Everett, which is dedicated to improving the health of seniors living in Everett.
Excellent. We need to move that program to Somerville.
Duplicated.
Duplicated.
Yes.
That's right, duplicated. So I want to thank you all for being here today. It's a great opportunity for us to talk about a brand new program called Firehouse Model Space. And it was very intriguing, so it really caught my my interest, and I was really excited when Janice and I had an opportunity to talk about it and decide that this is a model that we wanted to try. So tell me a little bit about what this model is and how it affects us in Somerville.
So the Firehouse model is our idea for starting a community health worker program in the area served by Cambridge Health Alliance, including Somerville. The reason we call it the Firehouse model is, we started with hospitals where people would come to get their care, and then we realized we needed to move out into the community, so we have community health centers where people come to get their care, but we need to bridge that last mile by getting to people in the community. So the idea with the name is, when you have a fire, you don't ask the fire department, you don't bring your fire to the fire department, they come to you. So the community health worker program, the Firehouse model, is coming to the community where they are.
It's a great concept. At our building, way before you came, Janice, we had a 60-plus clinic there. And it was amazing how many elders would use that program because it was there. It was sort of like a one-stop shopping. They could come in, they could have lunch, they could have a program, they could stop by and see the doctor, see the podiatrist, get some of their prescriptions rewritten. They don't have to go too far. They had transportation because they're already coming. So is that the type of model you're looking at?
Well, we're not duplicating what health clinics do. We're the extension of that. So community health workers do something a little bit different than clinicians and other people. Their role really is to connect people to care, do health education with people, and sometimes do screenings. So we want to do things that, some of them could be done in the health clinics, but mostly it's things that we want to do in the community, reaching people where they are that wouldn't otherwise happen. So for instance, if people are already patients, a lot of our patients work 2 or 3 jobs. It's very hard to get back in to have that blood pressure rechecked or to have that screening test done. So in some of those cases, we can do them out in the community. So the community health workers that we're working with will be on our electronic medical record system. So they will literally be an extension of Cambridge Health Alliance. So if you're a patient and you say, I just never get back in, I should really give this information to my doctor or my primary care team, or I should have my blood pressure checked, they can do all that and get it right to your primary care team. For people who aren't patients, we just want to educate the community about health issues, why it's important to have health access and health insurance, and other basic health topics.
It's really an interesting model, especially, Janice, for your students downstairs and some of my older adults who don't have easy access to that,
That's right.
can't get over to the facility. You know, even though Cambridge is a mile away, it's really difficult for them to get. There's no direct bus line, so for them to get over there, it's not really easy. So this is, for your students, really a great time for them to be able to access a medical facility without actually getting to that facility. How do you feel
Absolutely.
about that?
Oh, I feel wonderful. I think the opportunity to merge and have this program is what is needed in the city currently. I think you're absolutely right, Cindy. The 3-job factor, time, and the fact that we actually use health as a part of our curriculum takes it to the next step. Because we talk to them about talking to your doctors. We educate them about exams, tests, screenings for good quality health. Now they actually have the wherewithal to take the next step, to go upstairs, to act upon the knowledge that we're trying to teach and help them and actively pursue day in and day out. So this is going to be a great model. And I think, which is a point you're going to get to, is that Somerville Scale students will actually be not advisors, what's the correct term?
Well, they'll the title of volunteer health advisors once
Okay.
they complete the certificate program at the Cambridge Health Alliance.
And this is a great opportunity for us all. We work together anyways, so it's a great opportunity for us to work together. But I think the important piece here is that, you know, like you were saying earlier, they need to get to the doctor to have that blood pressure rechecked. They need to get maybe that glucose done, or to have something else like very limited done, and they just can't get there to get it done. And I know my elders will say to me sometimes, really doesn't matter. It's just a blood pressure check. I can go back in 6 months and do that. Well, in the meantime, 6 months could be really dangerous for them to have that blood pressure issue. So it's important for them to be able to have that. I know it's one of the most important things that we bring to the center is for them to have blood pressure checks. We do a lot of wellness programs over there, a lot of exercise, a lot of health. When we do our health fair, the line is out the door, out the door for those little medium tests that they can do.
Right.
So I think you're really on to something. Tell me, has it worked someplace else?
No, this is the pilot site.
Yes.
We wanted to find
love
the
being the
first place to
first.
do it, and we thought this was a great location because we've got the elders, we've got the students at scale, we've got a whole range of the community there who we're trying to access. So if it works here, we will bring it to other sites. We're trying to locate it in 2 other sites at the same time in Cambridge and Malden, but Scale and Council on Aging will be the first.
Awesome. We love to be first here in
Pioneering.
Somerville. Pioneering. So we're going to take a quick break. This is when you get your pens, your paper, and find out all the great, exciting programs that we have going on at the Council on Aging. We'll be right back. That was fabulous. What a great variety. I cannot believe we're talking about December, folks. Summer's just starting, but we already have things planned into December. So we're talking about a firehouse model where we're taking programming from the hospitals into our senior centers and into scale. And tell us a little bit about what your ultimate goal would be for this program.
Our goal is for people in the community who don't have access to care or knowledge about healthcare to have both. So many people in the community, and we think even students at scale, probably aren't accessing healthcare services that they could be. For many people, it's a barrier. They think they don't have the right, or they think they don't have the right paperwork, whatever it is. And a big part of what we want to do is show them that everyone has the right and everyone can have access. So that's success for us.
And we talked a little bit about having programs physically come to the location. Do you know the types of programs you'll be bringing in, like some kind of test, or is it blood pressure, or what are the things that you'll be able to do on site?
So the community health workers will be able to do a wide variety of education. So around healthcare access, health insurance. We'll also be doing tests and screenings for blood pressure, like we said. We can do HIV screening, and I think we can do cholesterol screening. So we can do some screening tests, but mostly it's going to be about education.
That's incredible. Now, you talk about doing insurance information. Will you be able to physically help them with any kinds of applications, or how will that be?
So we can't do the applications ourselves for the state, but we're going to have colleagues from another program sitting next to us who can, in real time, do the application with someone, or we can direct them to an insurance office at Cambridge Health Alliance. And
it will really help that we have two SHINE workers upstairs at our program. So,
yes.
And for those of you that don't know, SHINE is serving health insurance needs of elders. So we can help with the Mass Health applications and helping them choose the prescriptions and all that to go in line with them, the Medicare Advantage programs, to help them connect up with Social Security to sign up for Medicare because it's so important. And for those folks who need that help, to help them sign up for Medicaid, which is important. So I know that we're working on a big part with and training some of the skilled students to be able to work with the older adults upstairs. So tell us a little bit about that program. And James, did you want to talk about that?
Okay, sure. So I teach on a very part-time basis at scale, but work full-time at the Cambridge Health Alliance, and I saw real synergies between both of the programs, and because scale has this goal to help people be college and career ready. At CHA, we're really dedicated to improving community health, and we actually see improving people's socioeconomic kind of status as one way to help improve the community's health. So Scale proved to be a really fertile recruiting ground. So we actually have 5 Scale students who entered this year who are demographically diverse, and so they really add to this mix of volunteers. So we have 16 different languages, people from about 30 different countries in the VHA program, so that when people are coming through for screenings and services, most likely we're going to be able to provide the health education services and the screening services in their native language. And also recently with the Volunteer Health Advisor program, we've started recruiting foreign-trained health professionals. So we have a lot of people who were really malemployed, people who may have been orthopedic surgeons or cardiologists, but here maybe a server at Dunkin' Donuts or a cashier at a department store, or even doing house cleaning here. So there's all of this kind of untapped talent, and it's people who are really looking to enter the system, polish their resumes, and do work that's meaningful to them. So this is really the quintessential win-win situation. In May, we have these 5 Scale students finishing the program, so they'll actually be ready to go to offer a lot of the screening services and seeing the upstairs of the building and working with the seniors. And sort of with that, we even have 4 seniors who are trained to do the health screenings, 2 in their 70s, 1 in their 80s, and 1 in her mid-90s.
That's incredible. So tell me, how did you screen these folks? Are there some criteria that you felt were better than others? I know you just didn't go in and say, okay, you, and you. So tell me how you came across these 4 elders and 5 students.
Okay. Well, with the 5 students, it was a presentation that was done at scale, and really students who were interested approached me afterwards. The next step after that is they fill out a very brief application, and then there's an interview. And what we're really looking for is, people who have that helping spirit behind them. But so we didn't require that people had health backgrounds, because we do provide that training. In many cases, we were fortunate enough to have people with both sets of experiences. With the seniors, actually, we have someone who was a scale employee, who was a retiree, who's part of the health education team. So she was really nearby.
Perfect. It made sense.
And our other 3 seniors are seniors from the Aging Wisely Everett program.
Perfect.
So they go to the Connolly Senior Center in Everett. So they're coming over from Everett to help us throughout our whole service area.
And is this a program that you'll be looking to expand on?
Well, we'd love to expand it, but I think, as Shakespeare would say, "'Tis a pity when such a fair face is accompanied by an empty purse." So
You hear that
that's
so often.
Yeah, that's my English language side. So, now back to my health side. We operate on a really tight budget in a tight team, in a small staff. So we're part of my time goes towards this project. We have another person who's at 32 hours a week on this project, and another per diem person. So right now we're managing a group of close to 50 community members. So that's really a lot for us right now. But if any of your viewers have funding sources to expand the program,
Obviously. That's great. Tell me, we talked about, Janice, first of all, tell me, the students must be really excited about moving forward, and what an opportunity for them. I was watching a documentary about how so many folks come over from their country to this country, and then they're doctors and lawyers, and they can't practice. And as you said, they're serving at Dunkin' Donuts, and how awful they feel that they have so much knowledge and are not able to put that out and work with that. So for your students, this really must be an exciting opportunity.
This is an unbelievable opportunity, and again, let me publicly thank you for the merger and the partnership, and your support, Cindy, has always been paramount in anything that we do. So I thank you for that. And it does us well, and in terms of scale, to see our students come full circle. They've come to this country, they've made a choice to live here and be with us and to share their knowledge. And the only barrier I think that we really would see is the language barrier. The knowledge and the content is there. This is about a language barrier. So to see the programming that we offer at scale help them overcome this barrier with a lot of work from themselves, really, a lot of work that they have to put into it, to see them now be able to take this step to actually contribute back. And as you said, they're volunteers. So they're investing back in the community that they've now chosen to be home. And that's a wonderful, wonderful statement. And people often ask me, what do your students do after graduation? Fabulous things such as this. They volunteer back into the community to help others also bridge or overcome transitions or things that inhibit them from leading a high quality life. I think the biggest thing is when you walk into the center, and you know this as well as I do, to see someone who can speak your language, identify with you,
Absolutely.
understand your journey, and then assist you in overcoming barriers or obstacles or needs. That is the best thing that anyone can help. I think that their pure presence will be significant.
And I do think it's very important to have that language for a student and an older adult come together, because we had a program last week, and we peered off the younger folks with the older adults and had them sit together in their in their language, who spoke Portuguese, who was Spanish, who was Brazilian, who spoke Haitian, and it was amazing. And all of a sudden, the talking was like da 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 Like, okay, folks, can I have just a minute? You know, they were so excited that they were speaking in their native tongue and were able to express to these young folks who were just becoming mothers their experiences. So for this healthcare process, to have somebody who's going to be able to speak in their language is so important and so comforting. I think that's part of it. You know?
I think for the community members, the language is really, really important. Just Friday at one of our screening events, we were at a company that had 20 Brazilian employees, and 11 of them did not have health insurance for themselves or their families. So they were able, through the health educators and the VHAs, get connected to financial assistance or get connected to what they need to do to get their health insurance in place. And we helped shepherd them through that process in their native language. And I think the other piece is that for a lot of the scale students and the VHAs, it's besides language, it's just knowing how to get into the system, getting the foot in the door. When you're at Dunkin' Donuts for 60 hours a week, or you're working as a nanny, this is really an avenue to sort of show what you can do. And actually quite recently, we just hired one of the scale students who was working in house cleaning, and back in her home was a microbiologist. So for a lot of students, it's really about regaining some of their dignity, right? In using their talents to benefit us here.
It's amazing. It really is.
So the community health worker program, like the VHA program, it's also about workforce development. That's what a lot of this is about. Bringing people up, using the skills they have, but giving them new skills and new opportunities for employment. The state very soon is going to be starting to certify community health workers for the first time.
Wow.
So there'll be many, many more jobs in community health work, and we want people to be ready to take those jobs.
This is very exciting. I hate to break, but I have to take a quick break. We're going to introduce you to a program we did last week. We were talking about this. It was a baby shower for single moms, and our seniors came together, and we had a beautiful time. So just watch for a quick second. Good morning and welcome. We're here today at the Council on Aging. We're hosting a baby shower. We're so excited. We're in collaboration with Somerville Public Schools, and to my left is Naomi, and we're so glad to have you. Thank you so much
to be here.
Thank you. Tell me a little bit about what your collaboration is, your program is actually called.
So we are called the Somerville Family Learning Collaborative. Many people know us as the SFLC, the Family Engagement Department of the Somerville Public Schools. And we work with families birth through adulthood. And this is a particularly spectacular collaboration because we have expectant parents meeting elders who are the wise grandparents.
And we certainly hope that's what's going to happen. We hope to foster some grandparent and some bonds here today. We're very excited. All through the month, seniors have been bringing in little trinkets and all kinds of stuff, and we decorated the room today, and they are so excited about being here and hosting this little baby shower. So tell me what you have. You have a great bag.
So we are launching our Summer Baby bag, which is a welcoming bag for all residents of Somerville. We're starting with about 50 families, and there are a variety of contributions in this bag. The Kiwanis Club of Somerville was incredibly generous in helping us to furnish these bags. There's a book. Well,
Beautiful
there's
blanket.
a
Let's grab the book.
handmade
I want to
baby.
grab the book. Great book here.
There is a book. We have it in English and Spanish. We have a cup,
Some toys, it looks like. Oh,
stacking cups.
beautiful handmade blankets, some diapers, it looks like.
Yes, this is a guide to child development in English, Spanish, Portuguese, and Haitian Creole, and then a resource guide of services in Somerville. So please call the SFLC if you're interested in one, and we hope to expand this program to all young families in Somerville having babies.
Again, it's our first collaboration with the public school system at a lovely baby shower. We had a lot of fun putting this together, and we're very excited about it, and we welcome you all.
We hope that we'll foster some grandparenting program here, and you'll come back and visit us. And we have a special event every February where you can bring your children in and again have some lunch with us and some ice cream and cake, which I know you all love. So we have some great things coming up as well.
Bem-vindos todos aqui, então.
Bienvenidos a todos.
We want to we want to thank you again, and we're so excited that people are telling each other their stories of either how they came to America or their life in Somerville.
Que estamos todos muito felizes que vocês estão aqui e de estarem conversando e contarem as histórias de vocês, de como chegaram nos Estados Unidos ou aqui em Somerville, como vocês vivem aqui em Somerville também.
Que estamos contentos porque todos se están reuniendo, están compartiendo el ver cómo llegaron ustedes aquí al país y todas sus anécdotas desde que han venido a este país.
We want to thank Katie Duchin from the BU School of Social Work, who invented this idea.
Getting to know you, getting to feel free and easy. When I am with you, getting to know what to say. Haven't you noticed? Suddenly I'm bright and breezy because of all the beautiful and new things I'm learning about you day by day.
So welcome back. We had so much fun that night at the baby shower. Everybody walked away with great smiles on their faces and full bellies and lots of prizes and gifts. So we're talking about the Firehouse model, and I'm so excited about this. I really am. I think it's going to be great. It's a partnership between SCEAL, Council on Aging, Cambridge Health Alliance, and Cambridge Health Alliance has brought this to us, and thank you so much for doing this because I think it has a great opportunity for major growth. But tell me, why is it most important now?
Well, as I said, because the state is about to start certifying folks as community health workers, we really feel it's important to start training people to be ready for those opportunities and for the community to be ready to work with community health workers. Community health workers have been around for a long time, but now they're actually going to be able to get paid in a way that they didn't before. And institutions can use them as community health workers and bill under licensed clinicians. So it's really going to be a much more integrated part of what health institutions do. So we really want the communities and the prospective community health workers to be ready now for it.
This is such an amazing program, and I see it growing pretty quickly. Are you prepared for that? How are you going to handle that?
Baby steps first. We
Baby
want
steps,
to
okay.
show it works well
Okay.
At SCALE and Council on Aging and a few other sites. And then when it does work well, we will scale it up,
Okay.
hopefully.
So tell me when it's going to start, first of all.
We're going to start probably next week. We'll be on site, we hope.
Okay. And then that piece of it will be training the 5 students. What's the next rollout
Oh, well,
piece?
the students actually come for 12 consecutive Saturdays. So they actually give up their Saturdays. So in addition
Wow.
to going to scale 2 to 3 days a week, they're doing as much as a full day of training on their Saturdays. And
Talk about dedication.
they're very dedicated. And then once they actually complete it, they're required to put in 75 field experience placement hours. So the type of work that they're doing under Rob's supervision. And then after that, they go back to monthly continuing ed sessions. So the learning is constant. So these may be our students for years to come, actually.
Great. So we can expect it to roll out pretty fast in the next couple of weeks, and we'll be doing lots of stuff. Well, I'd like to book them already for, in October we have a health fair, so we want to get them upstairs for that health fair and make sure they're there. But I do want to say I think this is a fabulous program. I'm excited about it. It's called the Firehouse Model, and it'll be housed at 167 Holland Street. For more information, you can call myself at 617-625-6600, extension 2300, or Janice Philpott, the Executive Director for Scale, who's a great partner in our building, and we thank you so much. We couldn't do it without you downstairs, so
As well
thank
as
you
you.
for your help.
Thank you.
And Janice is at 617
625-6600, extension 6941.
6941. Well, we thank you, and until next month, we hope you'll have a great day and enjoy all the wonderful activities at Council on Aging, and more great things to come. Thanks. Have a great day. Bye-bye.